Today I am joined by my good friend and colleague Samantha Sacramento, the Minister for Civil Contingencies, who has been working non-stop since this crisis began. I would like to start today by thanking you all for taking the time to listen to our press conferences over the many weeks. As we approach our lockout phase 2, which starts on Monday, our daily conferences will come to an end. We will be able to see our family and friends in gatherings of up to 12 people. We will be able to start to regain part of our lives back. Some sports will also resume. But we must always try to keep our distance, because even though we are able to once again begin to interact a little more as we used to, COVID-19 has not disappeared. This is most important. We can never know where we will be in 2 weeks' time or even in 2 months' time, and we can only look to other cities and other countries to try to see patterns and learn from their experiences. We are geographically closest to Spain and will also be most affected by the UK due to our strong links and proximity. Spain yesterday reported a fear of a second wave, which has been seen in many other cities. Releasing the lockdown was always going to be far more difficult than locking down itself. The very act of being locked down over time leads to a natural urge to want to be let out and run back to how we each perceived to be our normality, with our customs of social interaction and social closeness that gives so many of us that sense of comfort. But today, we are in a very good place. Our rates of infection are very low, and we have all worked very hard to stay safe and keep our most vulnerable safe. And we have achieved just that. Now, our best friend is time. We must buy as much time as possible to ensure that somewhere we can find ways of ridding ourselves of COVID-19, be it by way of a vaccine or some type of treatment close in the future. Our aggressive contact tracing program will ensure that if we have any new infections, we may be able to keep them at bay and restricted to those with the infection. Contact tracing is what will allow us more freedom, but we must all be sensible and not rush out as if school had ended for the summer, because it has not. If we don't keep respecting the rules, even though the law may no longer impose these upon us, we may find ourselves once again at increased risk of infection. In this way, we may have the best chance to live healthy lives, better lives, appreciating that we are susceptible not only to COVID-19, but any other virus that may come our way in the future. Things we take for granted today, we may not have tomorrow, and the things that are most important to us have to be our families, our parents, our grandparents, and our health, because these are irreplaceable. Our material possessions are worthless if we are not fit and healthy to enjoy them. But there are so many positives that have resulted from COVID-19. Our environment is so much cleaner, our air quality so much better. So many people have used this time positively to exercise, to walk, to jog, and to cycle. COVID has planted the seeds for a healthier future. It has made us look deeper into ourselves. COVID has taught us that it's not only those over 70 that are vulnerable, but also those who are obese, and who, as a result of their obesity, may have uncontrolled diabetes or even underlying heart disease or any other disease that is made worse by obesity. Even the younger, unhealthier, and unfitter members of our community may be even more at risk than fit and active over 70s of normal body weight. We must take particular attention to our diet. We must eat well, avoid unhealthy fatty and sugary foods, eat balanced meals with low levels of fat. We must eat fruit and vegetables, which so many people avoid. We must take regular exercise. We have seen so many people power walking and cycling. We must all try to keep this up now. As a government, we will try to do our best to make our streets healthier, cleaner and safer, to try to encourage people to go out for a walk, to eventually want to walk to the restaurant and then walk home afterwards to keep fit. The more active we are, the healthier and less at risk we will be of disease, infection and illness. I will now share today's COVID statistics. As of this morning at 8 a.m., the total number of swabs taken so far was 5,060. There are 182 results pending, and the total results received to date is 4,878. We have a total of 4,613 negative test results, with 147 confirmed cases and 2 active cases, which is 1 down from yesterday. We therefore now have 145 recovered cases. Our hospital statistics this morning are as follows. In the last 24 hours, there have been a total of 52 attendances to A&E. Of these, 5 had symptoms that could be related to COVID-19. There have been no admissions to John Ward, which is our COVID ward, in the last 24 hours. There was 1 admission to COVID CCU overnight, which has resulted negative and who will be transferred to a clean ward later on. Once again, we have no suspected or confirmed COVID cases within the hospital. A total of 2,270 swabs have been taken via our drive-through facility, and we are now able to turn around test results within 2 hours. We have carried out a total of 1,803 tests locally. As the GHA starts to plan our restart of clinical activity, we are initially focusing on screening services to detect any cancer or other serious condition where symptoms may not be apparent. I specifically refer to mammography, cervical screening, colon cancer screening, aortic aneurysm screening, and well person screening. However, I wish to assure our community that urgent cancer referrals have never stopped at all during this time. As of the 22nd of May, GHA unlocking stage 2 of our GHA restart commences, with patients who are on the early recall list for screening being invited for their screening investigations, including endoscopies, mammograms, smear tests, and ultrasounds. GHA unlocking stage 3 on or around the 12th of June will see the commencement of routine non-urgent screening of the healthy population. This will initially take place observing the rules of social distancing by ensuring gaps between appointment times to minimize the chances of patients mixing in waiting areas. At GHA unlocking stage 4, on or around the 3rd of July, we will commence full lists of patient screening tests, because at that point, if we have managed to remain COVID-free or have very low infection rates, we will be in a great position to speed up and hopefully start to regain ground on any waiting lists that have developed. We are very aware that many people are on waiting lists for surgery, and we have not forgotten this. As we gradually restart our clinical activity, we still need to ensure that it is safe for any patient to come into hospital and not contract COVID-19. Also, evidence shows that during the recovery period after an operation, if a patient contracts COVID, the outcome can be very poor, as the immune system is already strained dealing with the process of recovery itself. So some operations in particular, including the bigger operations such as joint replacements, which require very sterile conditions, pose a significant risk, as we cannot guarantee that COVID is not within the community. Surgery will resume as soon as we can ensure that it will be fully safe to bring someone back into the hospital environment. We would not want any complications that could result in grave harm for a procedure that could wait a little longer. Nevertheless, we are very aware that some people awaiting orthopedic surgery may be in great discomfort or pain even, and this can be very hard to understand and accept. For our elderly residential services, other timelines will apply for their restart, as we need to be extra careful to ensure that our most vulnerable remain protected. These will run behind the GHA unlocking stages for the general population within the acute hospital setting. Of particular interest to all those watching at home with family members within the ERS facilities will be when visitors will be allowed back in to visit their loved ones. The plan is that the first visitors will be permitted as of the second week of June, whereby 1 visitor per day wearing PPE will be allowed to visit between 4 and 6 p.m. By or around the 6th of July, 2 visitors will be allowed to visit together, wearing PPE between 4 and 8 in the evening. Normal visiting is expected to resume by the 20th of July. These timelines are subject to change as per our conditions for unlocking, should we encounter any increase in COVID-19 cases. As always, we wholeheartedly trust the advice as provided by our clinical teams at ERS, who always have the best interests of our ERS residents in mind. With regards to antibody testing, there was a question at a previous press conference which I have discussed with Dr. Rawal in order to be able to provide an answer today. We have sourced antibody tests through 3 industry leader suppliers, Abbott, Diasorin and Beckman. These are suppliers who we have excellent working relationships with, who supply reagents for nearly all our laboratory tests locally, and who notified us of their antibody tests over a month ago. As a result, we were able to be listed preferentially for supplies of these tests. In total, across the 3 suppliers, we have ordered 35,000 tests for a whole population testing strategy and a further 20,000 from Abbott for cross-border workers. The tests need a proper blood test and are not the so far unreliable finger prick tests. We have not ordered Roche tests as we do not use Roche analyzer machines within our laboratory. Our tests are just as accurate as the Roche tests. We have not confirmed a definite arrival date for these tests, but we will announce this in due course when this information is available to us. As we now move into uncharted territory, we must take each step at a time and move slowly. This phase is very hard for all of us, as we all desperately want to try to regain our lives. We must, however, look cautiously at other cities to see how things evolve in other places, but especially we must look north to Spain and the UK, as they are our closest neighbours in terms of movement and travel. We have done very well, but we cannot let our guard down now. As we slowly start to return to a life we are more used to, we must consider our actions carefully so that we minimize our risk to ourselves, and in doing so, we also minimize the risk to our families and the community. We must observe the advice given by public health by way of social distancing, avoiding large public gatherings, washing our hands, and allowing each phase of the planned unlocking process to take place at the right time. We still have a way to go. The good things that we have learned from this unpleasant experience, we must now try to keep. The good practices that will help to keep us safe, fit, and healthy. We must also keep at the forefront of our minds that we are what we eat, and we are how we move. The way we choose to live our lives is of paramount importance to our health and well-being. When we draw back the curtains, will we wish to see our old life return, our previous normal, with traffic-ridden roads, queues at 8:45 in the morning, even on sunny days, and polluted air? Do we want to go back to an unsafe environment for those that walk, cycle, or wish to do exercise? Do we want to go back to that place where we feel unsafe each time we cross the road, with motorbikes whizzing by, motorbikes overtaking, undertaking, cars sounding horns in the rush to get somewhere, cars double parked on pavements where families with prams need to step out onto the road to get past them, and polluted air? Do we want to reverse the effect of that exercise that so many of us have been doing so very well? If that's what we want, that is really easy to go back to. We only have to return to our cars and drive those 500 meters to get our child to school, eat unhealthily, stop exercising, and simply get fatter, hoping that there will not be a return to COVID or even another virus. What we have achieved so far would never have been possible in such a short period of time, ever. People are walking, cycling with their children, exercising, feeling safe, feeling healthy, losing weight, getting fit. It's up to all of us now. We need to decide. COVID-19 has provided challenging times for cities throughout the world, but there are a lot of opportunities, and many cities are responding in ways unheard of in the past, opening the way for a fitter, healthier future. There are many positive initiatives out there to read of, to learn from, and to consider for ourselves. For a small city, we have opportunities unimaginable. It takes a lot of courage to take steps in the right direction. It takes conviction to try to achieve change, and it also takes acceptance. But change is change, and human nature does not adapt easily to change at first, and that is a fact. But many people appear happier to see these changes taking place in our lives, and now is the time to try to make these changes stick. But it is our choice. COVID seems to have given us a chance, and so far we have been let off very lightly, with just 147 recorded cases compared to those images that have haunted us of people lined up on stretchers in corridors, people on ventilators, people really sick in other places. Let us now be very careful as we start to enjoy life once again, because the effects of our actions today only manifest themselves in 10 to 14 days' time. This will make it very difficult to measure the effects and the consequences of our actions today. Changing our lifestyle will make us better, fitter community, and the benefits will be huge. I'm excited for our future because I think that together we can make a massive difference to Gibraltar. I think that COVID-19 can make us stronger and healthier, and it can teach us to accept what we have. In this way, Gibraltar can become a better place, one that attracts people to us, especially tourists, perhaps because we are a sensible society and a safe and greener place to visit. We will do very well indeed if we set our minds to it. Let's keep safe. Let's observe the advice. Look after ourselves. Keep fit. Eat well. And keep healthy. Before I hand over to Minister Sacramento, I would like to give my thanks to a young lady called India for her thank you card and her lovely present of a lovely doll that a man in a suit with a beard of a man in a suit with a beard that works with her dad. Thank you, India. Finally, one last thing I'd like to say. I would like to thank you all. I would like to thank especially my GHA, ERS and care agency staff. I am so very proud of you all. Thank you. I will now hand over to Minister Sacramento.
Thank you very much, and good afternoon, everyone. I hope that you are safe and well. As we've just heard, we have only 2 positive cases of COVID-19. We have to be thankful for that, because that figure is low. We must, however, not forget that the virus continues to be among us, and we must behave as such, because our figures could change and they could increase if we don't. As you know, the second phase of unlocking commences next week. The lockdown regulations fall away on Wednesday, which means that they will no longer continue to operate as from Thursday. This, however, is not to say that the virus has gone and that we can return to normal. It simply means that as a government, we are not prohibiting you from leaving your home. However, we are not encouraging it either, and our advice to stay home remains. This, of course, at this stage will now be advice. Going forward, we must manage how we live with this virus being among us, and we must do so with great care and caution. The methodology to give effect to how we unlock from the lockdown must be a careful one. We must still have precautions in place, and unlocking will entail restrictions. A lot of common sense will also be required, and we should not let down our guard. Work to give effect to the measures to enable the unlocking of the lockdown are well underway, and the teams have spent long hours this week and have also worked today since very early this morning as we continue to formulate the rules, guidance and advice. Always, of course, based on the advice given to us by the Director of Public Health. In the coming days, we shall be publishing guidelines for the sectors so that they can resume within the parameters in a safe way. Teams have been set up to ensure that we can give operational effect to the timeline, while ensuring that we do so safely. As you know, the answer to effectively unlocking the ROC will very much hinge on our test, track and trace strategy. We will continue the targeted swabbing of frontline staff, and thanks to the new public health lab, we will be able to test up to 300 swabs a day within 4 hours. Positive cases and their household will be asked to isolate for 10 days to minimize the risk of spreading the infection, and the team at the Contact Tracing Bureau will work with them so as to reach out to the people that they may have been in contact with. The government's use of its Geographic Information Systems, GIS, has been a useful tool in some of the decision-making process and will no doubt prove useful at the contact tracing stage. This system is a tool that offers a way to communicate geographic data in a meaningful way through the use of interactive maps and infographics. The GIS system and information dashboards record in near real time and can be an invaluable tool in responding to a crisis and predicting new outbreaks. In the coming weeks and months, we will continue to monitor and assess the longer-term impact of COVID-19. The GIS system will be very useful to assess areas and individuals at greater risk through tools such as contact tracing and the population modelling. This is a tool that has been entirely developed internally, and I would like to thank Dr. Liesel Messilio for her drive in tailor-making this tool for the pandemic and all her teams who have worked in solidarity to make this possible in a short period of time. Thank you also to the IT departments for being our backbone and enabling us to do what we have wanted to achieve, whether it has been replacing physical counters with virtual ones, enabling everyone to work remotely, setting up the apps and the new GIS system, or setting up a brand new IT system at the Nightingale Field Hospital and the new Public Health Lab at the Gibralta University. My thanks to Tyron Magnasco and Aaron Asques, the heads of the government ITLD and GHA IT respectively, who have led these teams. This process and these times have also shown us innovative ways of working. It has brought out the best in the public sector, and these better working environments will continue beyond the crisis. We will develop these as we map out the plans as part of the Restart and Recover Task Force. The reason why we have fared so well during this pandemic is very much down to you for following the rules. Thankfully, due to a combination of our early preparedness for this and for our community's cooperation, we have not found ourselves in the same situation that other countries around the world do. This is down to each and every one of us coming together as a community. This being my last press briefing, I would very much like to take this opportunity to thank everyone who has worked throughout the lockdown to enable us to get through this, whether working on the front line as a medical professional, or a cleaner, or a police officer, or people who have worked in offices to continue services, or those who have continued to work in supermarkets. Equally essential to this equation are people who have stayed home throughout this time, as this has been just as important. Thank you. There are, of course, too many people to thank individually, and I will highlight those who have worked with me directly through the Office of Civil Contingencies. To everyone at the GHA and hospital staff, and the staff at the care agency, who have worked so tremendously hard under the superb leadership of my good friend, Minister Paul Balbang, who has himself been leading in the most stupendous way. It has been a pleasure to work together so closely. I must thank everyone for the way that they have prepared for the worst. A special mention must go to everyone at Mount Alvernia and the other ERS facilities. The measures that have been put in place so early were clearly the right ones. This is in no small measure down to Susan Vallejo, whose formidable leadership, professionalism and tenacity has ensured that her teams have looked after the residents, such very precious people, in the best way possible. They truly are an example to the world, and I sincerely hope that their work is analysed and published in a medical journal, as many could learn a lot from what they have done. Thank you. During this time, the Office of Civil Contingencies has set up a public information call centre and response teams to ensure that no one has been left out during these difficult times. Central to our operations has been the work of our public information call centre, It has played a key role in establishing direct interface with our community. Our call operators have run a 24/7 service, and they have dealt with over 4,600 calls. The volunteers group, which has been so ably managed by Lisanne Peralta, David King before her, has dealt with over 1,300 requests and has supported the more vulnerable members in our community with shopping, medicine, important essentials and the disposal of their domestic waste. I'm especially grateful to the army of 1,155 volunteers who registered with us and given so much of their personal time to help those most in need. I sincerely hope that those who've come forward to give up their time will consider continuing to volunteer in respect of vulnerable people in future. I have no doubt that they will. Equally, the response teams under Dean Castry have worked hand in glove with the care agency to ensure that 130 vulnerable families have been provided with everything that they need, including weekly food packs and, importantly, checking up on them on a regular basis. I have been hugely touched to read some of the letters and messages of gratitude that have been sent to our response teams, as this has really shown the unmeasurable impact that the actions of our people have had on the elderly during their time of need. Only yesterday, I read a message from a 91-year-old who just wanted to tell the whole world what wonderful work the response teams were doing and that they had given him the best birthday present. Thank you. I must, of course, thank the Office of Civil Contingencies, a team who has worked diligently, tirelessly, and incredibly methodically to ensure a coordinated calm throughout these last 2 months. Long days and most weekends to make sure that everything was ready and that this was undertaken with military precision. They will, of course, continue to play an equally crucial role as we move forward to safely unlock the rock. I would like to thank the team, Ernest Danino, Brian Brooks, Laura Berridge, and Wayne Barton, all of whom work under the leadership of the Civil Contingencies Coordinator, Ivo Lopez. Thank you all for everything. Thanks everyone for all your rainbows, for your kind words, for your efforts, and for looking after each other. This experience that we've had to endure has most certainly also brought out the best in all of us, from the donations and the people stepping up to volunteer, to people looking out for and helping neighbours. Let's ensure that this continues to be the new normal too. From the very first sign of this threat, as a government, we took every available step to protect all who call Gibraltar their home and put all our resources to steer our rock through this global pandemic with the least possible damage and loss of lives. We succeeded in the suppression stage. As we now come out of this lockdown, please may I remind everyone that the virus continues among us, that the extent of what happens next is down to all of us and how we behave. When you're outdoors, the risk of catching the virus remains. We can mitigate the risk by our behaviours, by frequently washing our hands, by ensuring social distancing, and by following public health advice. Remember always that the more we move the virus. Home is still the safest place to be. Thank you for taking the time to join us in these information briefings. Thank you very much to GBC, our public service broadcaster, and to our press office who have been here every single day for these press briefings, and of course to all the journalists for their questions. Thank you very much, and I now hand over to the press for their questions.
From the Chronicle, Minister Sacramento, in respect of the courts, do you have any information on how many trials have been delayed and what are the implications for those on remand awaiting trial? Are there any measures currently being considered?
Well, the court service, the Chief Justice, who is responsible for the court service, issued a circular back on the 8th of April, I think, which relaxed the lockdown measures and made the courts available in respect of matters that applicants considered urgent. I know that during this time there have been applications heard. It's not that the courts have been closed. If applications have been made, applications have been heard, and they've been heard in different ways, precisely because it's important that we do not delay justice and ensure that justice is done. Cases have not been heard in person, I believe, but arrangements have been made for cases to be heard either on the telephone or through video link in respect of people on remand who have to appear in court on a particular basis. There is a video link between the courts and the prison, and that, as I understand, has been used.
Come back to you there on that one. Will it not take some time to be able to re-establish jury trials, though, given the logistics of getting a pool of jurors together? How do you see that coming back together?
I'm aware that the Chief Justice and the Court Service have taken specific advice on this from the Director of Public Health, so that courts can resume as normal as soon as possible. There is a timeline that the courts have prepared on the basis of this advice, so that cases can be heard, and there's the balance between, depending on the number of parties, and issues such as social distancing being achieved and all the other standard public health advice, such as ensuring that the cleanliness of the premises and that hand sanitizers are available. But certainly I know that the courts, which have not been closed, and I need to reiterate that point, the Chief Justice did make provision for courts to be made available as soon as that was possible. And I know that they are keen to open more fully as soon as they can.
Ministers, how hard do you think it will be for people in Gibraltar to go to this new normal? I mean, I was just walking down the street today and there was a couple of young couples holding hands, and I saw very little evidence of the desire to keep social distancing. I mean, we've spoken about this a lot, but it does seem that the message isn't getting through. Could there be something more proactive done, perhaps like people, wardens down the street, warning people about those social distances in those moments when they get carried away by their emotions and their old normal ways?
Okay, we need to look at old normal and new normal and the things that in the past we think were not the best things and that we should capture going forward. And then there's the issue of course, as you rightly point out, ensuring that we maintain social distancing going forward. Social distancing is between people from the same household and other people from different households. So people who live in the same household can walk down the street if it's necessary for them to do so, and they may do so if they're walking hand in hand. But you raise a very important point, and going forward, social distancing will be one of the crucial things that we have to maintain if we are going to stop the spread of the infection. You may have noticed that since last week, we have banners up and down Main Street. There's 3 of them that are hanging on Main Street, reminding us, or reminding anybody who's walking down Main Street, to ensure that they maintain social distance and all the other advice. And there's also posters that we prepared, and through the Royal Gibraltar Police, they are on boards that are placed strategically throughout Main Street. But you're absolutely right to ask that question. Social distancing will be one of the key factors that will enable us to unlock, because the closer that we are, the more at risk that we are of spreading the virus. And it's not normal and it's not natural for us to have this prolonged social distancing between friends and people who are not from the same household, but we have to be mindful of that.
I mean, in a society that we live, we're a close society, we're caring, we're loving, we are people, we're very physical. It will be extremely difficult. As Samantha was saying, it's normal, people will hold hands, and those people who are in relationships, it's expected, and people that live in the same household will be able to do things together. And for us to think for one moment, as time goes by, you know, we will be able to get closer to each other, you know, as we slowly start unlocking. Otherwise, you know, life cannot remain as it is today. But at the moment, we have to do everything we can that's in our ability to be able to ensure, you know, that we remain safe, because we're trying to learn, we're trying to, you know, keep ourselves, you know, as healthy as possible. But it is going to be one of the toughest things. I think the time that we've been in lockdown is still not enough for us to forget, that closeness, that feeling that we want to be with people. So it will be tough, but I think that, we must have said time is what we have to buy a lot of now, because as time goes by, there will be hopefully a cure, there will be a vaccine, and we will be able to come back to being physical again and doing the things that we're used to. But it will be tough.
We now move on to the questions sent from the press working from home or remotely. And the first one is from GBC for Minister Valvan. What efforts is the government making to ensure an adequate stock of PPE for the number of visitors who will want to attend ERS? And what will this PPE consist of, along with other measures in place to ensure resident safety? What will also be done in order to ensure that the personal protective equipment is used correctly by visitors?
As always, we must follow the advice of public health, and you would have noticed that the advice changes over time. So as this advice changes, we have to adapt to that advice. So it is our job and our role to ensure that we have adequate stocks of PPE for everyone, and be very aware of how things can change. We have to procure at the right moments in time. We have to be very careful that we don't run stocks low. We have our targets, we have our maximum supplies and our minimum supplies, whereby we will reorder. So it's keeping our contacts and suppliers open. We try to maintain as many supply chains open links as possible in case one should fail, that we have alternative sources. But it's something that we need to obviously take care of. Over time, we will be requiring less and less PPE, but again, there could be a surge in the future, and we need to be ready. But as always, we follow public health advice on when we should wear PPE and how we should wear PPE. Everyone within the GHA is very well versed on how they wear their PPE, how to put the PPE on, how to remove their PPE, because it's a very skillful process. It is not simple to wear PPE and remove it carefully and safely, but the experts in the GHA know how to do that very, very professionally.
The next question is from YGTV for Minister Sacramento. How will the contact tracing via the app be enforced if the GHA won't have access to personal information or even the user's name? Will it be possible for someone to receive a notification which they can then choose to ignore?
There are two forms of contact tracing, and the one that we've already started is the Contact Tracing Bureau. Now, that is a personal phone call. You may recall from my last information briefing last Sunday, where I explained how the Contact Tracing Bureau will work. Essentially, it's made up of 40 people who are there. They're actually undergoing training again this weekend. But their job is a bit of an investigation style of tracing, and it's a very personal way of tracing. And what will happen there is if someone tests positive, then someone from the Contact Tracing Bureau will contact them and speak to them about the people that they have been in contact with in the last few days, and then we'll ask for the contact numbers of those people and reach out to them to see if they're manifesting symptoms or not. And that's the work that's undertaken by the Contact Tracing Bureau, and that's already set up, and that's already in existence, and that is pretty much ready to go. In terms of the apps, there are a couple of apps that potentially could be available, but we're not actually using any apps as of yet, because you may be aware that the NHS app, which is the one that the UK are currently trialling in the Isle of Wight, is still very much at the trial stage. We have access to that and we have the codes to that, and that's something that will be a possibility, but because it's still being trialled, we don't know how it's going to be working in future. And as you know, we are in contact with other providers in relation to other apps. And as these are developed, we will choose which one we think is the best one for us. But by far, the one that will give us better information will be the information through the Contact Tracing Bureau. The app essentially will tell you if you've been close to somebody who has registered through the app as being positive.
From the Chronicle. Again, Minister Sacramento, are there any plans to update court IT infrastructure given the lessons learned from the pandemic? For example, hearings that are meant for the Supreme Court have had to take place at the Magistrates' Court because of the lack of video conferencing technology there.
That is very much part of the discussions with the Chief Justice, and that will be part of the Restart and Recover programme. We've all had to make arrangements and adjustments during this time. The important thing is that a court with a video link was made available to ensure that hearings were heard, but I know that the Gibraltar Court Service have been working very closely with ITLD to be able to enhance that capacity going forward. But it's very much part of the discussion, and you will have seen from the Unlock the Rock document, it's very much part of the discussion that's ongoing with the Chief Justice.
Okay, Mr. Balban, just a question about testing. How difficult will it be? I mean, I think this was mentioned this week, how testing is almost like a snapshot of the moment. And there was mention by, I think it was Dr. Batty, how they weren't very sure if they should test at the end of the summer or at the beginning of it, or during the summer. Do you have a particular point of view of your own, and do you believe that both the tests which are done continuously for finding out the disease and the antibody tests will result in a safer Gibraltar on the long run?
It's important to realize that there's two types of tests. We have the swab tests, which are carried out by PCR, and there are the antibody tests. Now, the swab test will give you an acute result. Will tell you, give you a snapshot, a photograph of where the person is at that given moment in time. You could, for example, get a negative result at one given moment, and then 2 days later, it could have become a positive, and so forth. So it is, as I said, it's a good snapshot to see how a person is at that moment, and it's something that we're using greatly, especially, and we will use it even more so as we start to restart our surgical procedures and get the hospital back on track. If you compare that to the antibody testing, it takes a while for the antibodies in a human body to actually develop. So, but once they do develop, there will be a clear result. So the antibody test will tell us whether you have it, whether you will have developed antibodies to it, and that will. But we're not sure, how long this immunity, if any at all, will be born from it. There are different theories, different, and again, the public health will advise us as we go along. At the moment, it's believed, it's thought that once you've caught the virus, you could, be immune for a relative period of time. We don't know how long, and that is something which we're hoping, will materialize, and we will discover. And what I would love to see is that once you've caught the virus, it never comes back again. That would be, I think, that is what we all wish for. But again, I think it's still very early days, and we have to see how the science develops and how we start to discover and learn about this what Dr. Batty calls this trickster virus. It's a virus that is not giving us, not showing us the reality, and it's elusive. We can't put a finger on it. And so, but at the moment, the tools that we have and the tools that we're getting in the next few weeks, hopefully, will put us in a much better position to be able to hopefully keep our population safe. And if we were to see that there is, an outbreak were to happen, then through contact tracing, we can hopefully stop that at its roots. So that will give us in itself a lot more freedom.
The next question is from YGTV for Minister Sacramento. What are the plans for the repatriation of British nationals and Gibraltar residents who are still stranded in Morocco? Will the government wait until Morocco's lockdown is eased, or is it contemplating another operation similar to last week's involving the RGP and Port Authority vessels?
Okay, the Office of Civil Contingencies is still very much in touch with the FCO and the excuse me, of course, had to cough. Apologies for that. Excuse me. By the way, they are allergies. In case you'll need to be reassured, I have been tested and my test was negative, but unfortunately I suffer from allergies, and it had to be typical that I had to cough during this information briefing. But we are very much in touch with the, excuse me, Foreign and Commonwealth Office, the British Embassy in Rabat and the Gibraltar Moroccan Community Association. We expect Morocco to announce a decision later on this week, on Wednesday, the 20th of May. But we're also actively working with a number of other options, and the option that was so successful last week is also an option that's available to us should it be necessary.
And the last question is from GBC, but before that I have a follow-up from the previous question to do with PPE and the ERS. And GBC is asking that given that PPE takes a skill to put on properly, how will the government ensure visitors put it on properly?
I mean, PPE, for actually going into a theatre scenario, into an operating theatre, there are very specific techniques. I'm talking of the extreme cases of a patient who's COVID positive and the staff need to protect themselves. There's so much, one can do. So there are different levels of PPE, and we have to be very reasonable and to what level. We can't expect people who are going to go visiting, their families at ERS, at Mount Avenia, or whatever, to wear, a suit as if they were going to go into an operating theatre. So obviously the staff, every time you go into Mount Avenia, there's a staff there, just as that the staff at St. Bernard's Hospital, who will ask you to wash your hands, to use a disinfectant for your hands, sanitizer. Then they will take your temperature and they will give you a mask and tell you how to use it. So best practices is what's used, and common sense. So the staff will guide people. But of course, it's not only how you wear your PPE, it's what you do when your PPE is on. I mean, if you play around with it, if you bring it down to be able to talk properly, even if you're drinking water and if you play with a mask, for example, then obviously it affects it. But again, I think it's something being reasonable, and if you adhere to all the common sense advice that PPE, that the public health is giving us, the most important thing is washing our hands. If we stay 2 meters away, and obviously we catch the cough, as we said, in a tissue and bin it, then there is no reason why we should be exposing or putting anyone at risk. It's only when you're at close quarters do we have to start considering whether and what we should be wearing. But again, I think the public health advice is what we should be following, and those questions obviously is something for the Director of Public Health to really give you a final answer on.
Okay, thank you. And now for GBC's second question for Minister Valvan. With many normally standard hospital appointments having been delayed by COVID and set to restart in phases, as you've set out today, is the GHA prepared for this backlog, especially given the gaps between appointments to ensure social distancing?
Obviously, it's important to realise that because of the lockdown, our waiting lists have grown. I mean, we cannot deny that. So now, what we're trying to do is restart clinical practice. We want to keep people safe. Most of all, that is the most important thing. For us to rush and see people very quickly and risk an infection at the moment where we are, it would be unprofessional and unacceptable. And once we get past the stages and we're back to standard, back to where we should be, then we need to start concentrating and looking at how we're going to reduce our waiting lists. And we have been planning and thinking about it. We're still in consultation phase with all the professionals, but there are ways that we intend to reduce wait lists. We now have to try to gain ground. And it's possible. We may need to look at hours of work. We may need to look at a number of different things. But what won't be acceptable is for us to run waiting lists which are longer than they were when we locked down. Obviously, initially it will be inevitable, but over time we expect that we will be able to catch up and bring our service back to that service that we're used to, and that obviously the population expects.
Okay, thank you. No more questions.
Well, thank you very much, everybody, for joining us this afternoon, and thank you once again to everyone from the press for being with us. Thank you, everybody. A final reminder to follow public health advice. Just because the regulations will no longer be part of our legislation next week doesn't mean that we forget that we are still at risk from this virus. So our advice continues to be the same. Please follow the public health advice. Thank you very much.
Thank you.